things. I mean, national defense has to be on the table too. Okay? This debt is a huge threat to our national defense. All right? It's a huge threat to our national defense because if we don't have a viable economy, a strong economy, we will not have a strong national defense. So that's the first thing. You can't make national defense sacred because, I mean, we do it at our peril. Short term, it might be good. Long term, it's not going to work. Second thing, this is why you have to grow the economy too. You can't have a stagnant economy and balance the budget. You have to grow the economy. So like I say, the Australians have a growth rate last quarter, 5% a year. 5 years, we grow by 5% a year, compounds, that's about 30% growth rate. That gives us 30% more revenue. That's why it can be done. You have to grow the economy. That's why you can't do it in 1 year. Okay? A week ago in Mankato, one of the blunt questions I got was, Al, would you support balancing the budget 1 year? I said no. Because the economic, I think the economic trauma, in my opinion, would be so huge that the cost would be too high. But I'm convinced we can do it in 5 years, and we grow the private sector, and there will be layoffs in the public sector, let's be frank. But we have to have a growing, expanding private sector to take up that slack, create that new employment, so on. So you have to grow the economy, then it can be done. Now keep in mind, I'm a numbers guy. I crunch numbers all the time. The numbers work. If you grow the economy. If you don't, it's not going to work. So that's the key. You have to do both at the same time. Other questions? Lynn?
I've been watching the concern over the leaks coming out of the administration on the defense programs. Is that something that you're worried about too? I mean, I just don't see how that, to me, that puts lives in jeopardy.
Yeah, Lynn's asking about the security leaks that are coming out of the administration. I think, you know, I mean, this is a travesty. Absolute total travesty. I mean, the leaks put our national defense, meaning our people, at risk. I think we need a new president. And for my part, I'm going to do everything I can to get the president elected. I also think we need a Republican majority in the Senate. At the same time, a House that is courageous and has a clear sense of direction can put a stop, can balance the budget. Because any spending has to clear the House. But you need a courageous, committed U.S. House to make that happen. Yes,
One more question.
Yes.
And going back to House and Senate.
Yes.
Currently, there's a 60% rule in the Senate.
Right.
They can't get anything done unless they get the, basically, break the filibuster at 60%.
Right.
Do you believe it should be 50 or 51% versus the 60%?
You know, there are very few things I don't have an opinion on, but you get one. I really don't know. I can see the arguments on both sides, but when it comes to controlling spending, you can't do anything without the approval of at least 50% in both the House and the Senate. And so when it comes to controlling spending, the filibuster, I don't think, is that much of an issue. Because it only takes 50% plus 51 votes to stop excess spending. I mean, on other things, Steve, it's a big issue. But on the spending, I don't think it's a particular issue.
So it's basically,
But-
of course, you got a Democratic Senate and a Republican House, and then they have to do anything, basically try to get anything. So, but that, I guess that's my question.
Yeah. Keep in mind, the filibuster rule in the Senate is simply a Senate rule. It's not law.
Yeah, I know.
It's not in the, it's not in the Constitution. So the majority party can change it if it wants to. And if I'm in the House and the majority party, let's say the Republicans have 51 votes, am I going to object If they change it, I mean, that's their business. And they can change it if they want. And who knows? For me, priority one is solving this. And for me, it's whatever it takes, short of being dishonest. I mean, whatever it takes, I'm convinced we have to do it. All very good questions. Any other questions or comments? Yes, lady in the back.
What is your take on the high cost of medical care in general?
Mm-hmm.
I'm not retired, I guess how I say retired, whatever.
Yes.
But my husband, we have to buy our health care, and the insurance since the 5-6 years ago that I quit my job
Right.
to be with my kids
Yes.
and be a full-time mom, just the premiums keep going up.
Yes.
Up.
Yes.
And, we just keep raising the deductible and figure, whatever.
Right.
But it just seems like it's just getting so expensive, just routine physicals and every little thing you do,
Right.
even if you try to be healthy and do,
Right.
and medical costs is such a big percent of the Minnesota budget too,
Yes.
all the people on there, and what can we do
So
about that?
So you and your husband have private insurance?
Yeah.
Okay. Before I answer the question, I want some facts on the table so we are aware of them. And the first fact that I'm going to put on the table is that in terms of the question, what should we do, and that includes what are the alternatives, all right? The Affordable Care, or the Affordable Health Care Act, Obamacare, it contains, and we all need to be aware of this, an incredible tax on married people. And I hate to be the bearer of bad news, but you have a right to know what this is. So let me do a what if. Okay, what if you and your husband have a combined income of $60,000? I'm just going to use you as an example. And let's say it's what if you each kick in 30. Under the Affordable Care Act, or Obamacare, private insurance, you will pay for your health insurance $10,425 more if you are married than if you are living together unmarried. All right? Now, I know that sounds incredible, doesn't it? About 3 months ago, Minnesota Public Radio did a polygraph test, a fact check on what I just told you. They issued their report about 5 days later, and they said, guess what, Quist is absolutely right in what he's saying. So when it comes to affordable health care, people need to recognize this extraordinary tax on married people. Now, if your combined income is $30,000, then you're only going to pay $5,000 more if you're married. But what couple making $30,000 can afford to spend $5,000 extra for the benefit of having marriage? For a lot of people, there's going to be a difference of making their house payments or not making them. Now, just so you know that what I'm telling you is not just Quist's opinion. The Heritage Foundation did a study of exactly what I'm telling you. They verified everything that I'm saying, said is all true. 2 U.S. House professional research teams have made a study of what I'm saying. And they both issued exactly the same report. What I'm telling you is exactly right. And I'm extraordinarily concerned by the fact that the American public has not been informed about how the Affordable Care Act will destroy marriage for the middle class. Just as the welfare programs have destroyed marriage for the poor. Okay? And I wish I were exaggerating. I am not. Now, when I speak, I usually don't toot my own horn, but this time I will. Because 2.5 years ago, I am the guy that discovered this. I'm the guy that discovered the marriage tax. And I held a press conference at the Capitol in St. Paul, and I held a press conference in Mankato. I was there all by myself, telling the world there's a huge marriage tax in Obamacare, and nobody has bothered to tell the voters that it's there. And I am here to tell the voters it's there, and it's real. And it's interesting to see the response of the press, because they couldn't believe that somebody in southern Minnesota, a farmer no less, saw something that the people in D.C. didn't see. And then I tried to get the people in Washington DC to see it before it was voted on. By the way, I informed Congressman Walz about it. And I let him know, you vote for this, you are voting for extraordinary discrimination against married people. And he voted for it anyway. Okay? The people in DC couldn't imagine that somebody in flyover country saw something that they couldn't see. Okay? It's not that it wasn't true, it's that it couldn't be true. And the break came when Congresswoman Michelle Bachmann, who happens to be a very close friend of mine, said to one of her staff researchers this. She said, look, I'm going to hold a press conference in about 2 hours on the marriage tax and Obamacare, and I want you to get the information together for me. And he absolutely freaked out. Information, I don't know anything. Not a problem, just call Al Quist, he'll tell you it all. Okay. So I get this call from this panicked researcher who works for Michelle Bachmann. Said, Michelle Bachmann says she's going to hold a press conference, and she needs information. What can you tell me? I said, do you have the bill in front of you? Yes. Do you have a calculator? Yes. Do you have a pencil? Yes. Okay, here we go. So I took them to the section, took them to the line. See this line? Okay, see this number? All right, now we go to another line. See this number? Now do the calculation. Okay. See this line? See this number? Do the calculation. So that's how it works. I said, yeah. It's very simple. Very simple. Now, why did I see that when nobody else saw it? 2 reasons. When I was in the Minnesota House, I wrote the bill that discontinued the Minnesota Department of Economic Security and replaced it with the Department of Jobs and Training. I know these kinds of, the workings of these things like the back of my hand. That's part of it. The other part of it is I don't care if nobody else sees it. I believe numbers. When I add 2 plus 2 in my calculator, it says 4. I don't doubt that. I don't care if nobody else sees it. But one of the reasons I say this is because we need people with the courage to turn this around. And I want you to know that I'm the guy that was willing to go out in front of 300 million people and say what nobody else was saying. And if you don't think that puts yourself at risk, guess again. Okay? I want you to know that I have the courage to do what it takes to turn this around. Okay, now what can we do instead of Obamacare? There's a lot we can do. A lot we can do. One of the first things that needs to be done, but I want to clarify this is really a state issue much more than a federal, but we have to get the legislators to work on it. One of the things we need to do is we have to have reform on the laws that deal with malpractice suits, what we call tort reform. There are some estimates, and I don't, it's one of the things I haven't looked at is the estimates in detail, but there are some estimates that suggest that defensive medicine, that is the doctors that order way too many tests and all of this to protect themselves from lawsuits, that this is costing us an extra 20% on our medical care. I mean, those are the high estimates, but it's certainly costing us a lot. And I personally have had very painful experiences with this because for years I carried $5,000 deductible and for my whole family. And when I'm told to take a test that costs $1,800, I'm thinking of all the fishing tackle I can't buy. Okay, so for me, this is a high price. All right. So that's part of it. Another part of it is Minnesota has something like 60 mandates it puts on insurance companies. It says you have to cover this, you have to cover this, you have to cover that. Why not let the buyer decide? I couldn't buy private health insurance for my family because I had one daughter who had asthma. And Minnesota law said they couldn't write me a policy without covering asthma. I said, well, just take it as a pre-existing condition. Don't worry about it. He said, we can't do it. They couldn't write me a policy. And the asthma wasn't serious. So yes, you put 60 mandates on insurance policy. Every mandate drives up the cost of insurance. Why not let the consumer decide? I mean, why do I need cosmetic surgery? I assure you, I'm not going to go there. So it's that sort of thing. Then you need competition between states. You know, in Minnesota, we can't buy insurance out of state. What kind of nonsense is this? It's all fencing operations by insurance companies. They don't want competition. Hey, free enterprise is all about competition, guys. If you don't like competition, go to China. You won't have to worry about it. All right. So you need competition. I think there are ways to get providers to advertise prices, so you can shop around.